Between 1940 and 1945, behind the barbed wire fences of Auschwitz-Birkenau, medicine was turned on its head. Doctors, professionals who had sworn to first do no harm, became architects of suffering, their white coats stained with the blood of innocents as they conducted experiments that defied both science and humanity. This isn't just another Holocaust documentary. This is the story of how educated men with medical degrees deliberately abandoned their ethics to inflict calculated torture on helpless victims, all while meticulously documenting their work as scientific research. Today, we journey into one of history's darkest chapters, where healing hands became instruments of unimaginable cruelty. When Nazi Germany established Auschwitz in occupied Poland, it created not just a death camp, but a vast laboratory where human beings became disposable test subjects. The Nazi regime's racial ideology provided a perverse justification for doctors to exploit prisoners without moral restraint. The transformation did not happen overnight. It began in German universities years before the first concentration camp opened. Medical schools incorporated racial hygiene into their curricula. Students learned to categorize humanity into hierarchies of worth. Professors taught that compassion for the unfit was misguided sentimentality that weakened the nation. By the time these doctors arrived at Auschwitz, their minds had been methodically prepared to view certain humans as nothing more than research material. Their education hadn't failed them. It had corrupted them in exactly the way the Nazi regime intended. Dr. Yseph Mangallay wasn't the only monster in a medical coat at Auschwitz, though he would become its most infamous. Alongside him worked dozens of physicians and researchers who viewed the constant influx of prisoners as an unlimited supply of human subjects for their twisted scientific curiosities. These weren't uneducated thugs. They were graduates of Europe's most prestigious medical schools, men who had once taken an oath to preserve life. Many held advanced degrees from institutions like Heidelberg, Munich, and Berlin. Some had published respected research papers before the war. Others had run successful private practices, treating patients with apparent care and professionalism. Their transformation from healers to tormentors represents one of the most profound betrayals of professional ethics in human history. Understanding this transformation requires us to confront uncomfortable truths about how easily moral boundaries can collapse when authority and ideology align. What you're about to hear happened under the guise of scientific advancement. The Nazi doctors kept meticulous records, wrote papers, and discussed their findings as though they were conducting legitimate research. This was calculated, systematic evil performed with clinical detachment. At Auschwitz, a clear medical hierarchy existed, a bureaucracy of brutality that distributed responsibility while enabling atrocity. The structure itself reveals how thoroughly medicalized the killing had become. At the top stood figures like Eduard Wirz, the chief SS doctor who oversaw all medical activities in the camp. Wirz was no foaming-at-the-mouth fanatic, but a calm administrator who managed the medical killing machine with bureaucratic precision. His signature appears on countless documents authorizing special treatments and experimental protocols. Below him worked camp doctors assigned to various sections, including those who performed the notorious selections upon arrival, deciding with a casual gesture who would live temporarily as slave labor and who would die immediately in the gas chambers. The selection process itself was presented as a medical procedure. Newly arrived prisoners, disoriented after days in cattle cars without food or water, would be met by men in white coats carrying clipboards. The presence of doctors lent a false sense of legitimacy to the process. Many victims believed they were actually being assessed for work assignments, not realizing that the brief medical evaluation was determining whether they would live through the day. Survivor accounts describe the cold efficiency of these selections. The doctors rarely spoke to the prisoners. They would simply look at each person for mere seconds, assessing apparent health and strength with practiced eyes, before pointing left or right, to life or death. Those deemed too young, too old, or too weak were sent directly to the gas chambers, often still believing they were going to shower facilities. Then came the research doctors, those who requested prisoners for their personal experiments. They competed for subjects, laboratory space, and funding from Berlin. Their experiments weren't random acts of sadism, but calculated programs designed to address specific questions of interest to the Nazi regime and the German military. Prisoners assigned to medical labor served as assistants, orderlies, and record keepers. Many were physicians themselves, Jewish doctors forced to participate in the corruption of their profession. These prisoner doctors faced impossible moral dilemmas daily, trying to provide genuine care when possible, while being forced to participate in atrocities. One former prisoner doctor later revealed that they would sometimes attempt to sabotage experiments or falsify data to spare victims additional suffering. These small acts of resistance came at tremendous personal risk. Discovery meant immediate execution, yet many still tried to maintain some semblance of medical ethics amid the horror. The medical blocks at Auschwitz weren't places of healing. In stark contrast to legitimate hospitals, these facilities were designed to facilitate suffering rather than alleviate it. Prisoners selected for experiments were housed separately, becoming living libraries of pain as their bodies transformed under the doctor's treatments. Most knew they would never leave these blocks alive. The sterile language used in camp documents masks the reality of what occurred within these walls. Terms like specimens, research material, and experimental subjects obscured the fact that the doctors were experimenting on terrified human beings who had no choice but to endure whatever was inflicted upon them. Yseph Mangallay arrived at Auschwitz in May 1943, already holding doctorates in anthropology and medicine. With his polished boots, immaculate uniform, and seemingly polite demeanor, he presented a deceptive exterior that earned him the nickname Angel of Death from prisoners. This facade of civilization made his actions all the more terrifying. His particular interest in genetics led to his fixation on twins, whom he personally selected from incoming transports. When trains arrived, Mangallay would sometimes call out in multiple languages, "Zwillinge heraus," twins out. Children would be confused as guards separated them from their families, not understanding why being a twin had suddenly become significant. Twins received special treatment initially, separate quarters, better food, and protection from immediate death. But this apparent mercy masked a terrible purpose. Mangallay wanted his specimens healthy before he began his work. Former research assistants described how Mangallay would sometimes bring candy or toys to child twins during initial examinations. He would speak softly, pat their heads, and project an air of gentleness. This psychological manipulation was calculated to make the children more compliant with the procedures that would follow. The contrast between these moments of false kindness and the brutality of the experiments that followed only deepened the psychological trauma for survivors. His twin research followed a standard pattern. First came the measurements, extensive, obsessive documentation of every physical characteristic. Identical twins were photographed, measured, and compared in exhausting detail. Head circumference, nose length, distance between eyes, and dozens of other measurements were taken repeatedly. Blood samples were taken regularly and in large quantities, often leaving children weak and dizzy. The thoroughness of these measurements reflected Mangallay's obsession with proving Nazi racial theories. He was particularly interested in hereditary traits that might demonstrate supposed racial characteristics. Yet his research methodology was fundamentally flawed from the outset, contaminated by his predetermined conclusions and ideological biases. Then came the experimental phase. Mangallay was particularly interested in eye color. Witnesses who assisted in his laboratory observed him injecting chemicals directly into children's eyes in attempts to change their color from brown to blue, reflecting the Aryan ideal. These injections resulted in painful infections, blindness, and sometimes death, as chemicals meant for external use were applied directly to sensitive eye tissues. Former assistants described children returning from these procedures with swollen, infected eyes, crying in pain that no amount of comfort could ease. Some developed severe infections that spread to the brain, resulting in agonizing deaths. In other cases, he performed unnecessary surgeries without proper pain management, removed organs from living children, and deliberately infected one twin with disease to observe how the other would react. His assistants reported that he was particularly interested in simultaneous surgeries, operating on both twins at once to compare internal organs while the subjects were still alive. When one twin died, Mangallay would immediately end the life of the other, often through an injection of chloroform directly to the heart, so he could conduct comparative autopsies. These killings were performed methodically, with Mangallay showing more concern for preserving specimens than for the human life he was ending. A former laboratory assistant who was forced to work with Mangallay later described how the doctor maintained scientific pretensions throughout this horror. He would dictate detailed notes during procedures, insist on precise measurements, and become irritated when subordinates failed to maintain his exacting standards. Yet his research lacked any valid scientific methodology. It was torture dressed in scientific language. Eva Moses Core, who survived Mangallay's experiments along with her twin sister Miriam, spent decades processing the trauma of her experience. In interviews before her death, she described not only the physical pain of the experiments, but the psychological torture of watching other children disappear, never knowing if she and her sister would be next. The uncertainty was its own form of cruelty. Children lived in constant fear, never knowing when they might be summoned for the next procedure or if they would return. She described how Mangallay's experiments resulted in lifelong health complications for her sister Miriam, whose kidneys never grew beyond the size of a child's. The unexplained injections they received had permanent effects that continued decades after liberation. Many twin survivors reported similar lifelong medical issues, though the precise substances used in many experiments remain unknown. Mangallay's research yielded no valuable scientific data. His methods were fundamentally flawed, his documentation inadequate, and his conclusions predetermined by Nazi racial ideology. Yet he maintained the pretense of scientific inquiry throughout, even sending specimens to the Kaiser Wilhelm Institute in Berlin for further analysis. The Nazi obsession with racial purity drove some of the most horrific medical experiments at Auschwitz. Those focused on mass sterilization. The goal was chillingly practical: to develop methods that could be applied on an industrial scale across Nazi-occupied territories to prevent undesirable populations from reproducing. Doctors Karl Clawberg and Horst Schuman led competing research programs, each seeking the most efficient method to sterilize prisoners. Their competition for resources and recognition created a perverse incentive to develop increasingly extreme protocols. Both men regularly reported their progress to Heinrich Himmler, who took a personal interest in this research. In Block 10 of the main camp, Clawberg injected caustic chemicals into women's reproductive organs without proper pain relief, attempting to cause scarring that would block the fallopian tubes. Former nurses forced to assist in these procedures described women screaming so loudly that SS guards would turn up gramophone music to mask the sounds from the rest of the camp. The procedures were extremely painful, and many women did not survive the resulting infections or chemical burns. Those who survived often suffered lifelong pain and complete destruction of their reproductive organs. Clawberg's methods were all the more horrifying because he had been a respected gynecologist before the war, known for treating infertility. He had perverted his expertise in helping women conceive to permanently destroying their ability to bear children. Former assistants later testified that Clawberg would perform these procedures with calm efficiency, seemingly unbothered by the suffering he caused. He would dictate notes as women writhed in pain beneath his instruments, recording their reactions as though they were expected experimental outcomes rather than human agony. Schuman's approach in the men's camp was equally barbaric, but utilized different methods. He positioned prisoners before an X-ray machine, exposing their genitals to massive radiation doses without any protection. The procedure itself was painless, leading some prisoners to initially believe they had escaped harm. But within days, the radiation burns would appear. The radiation burns were so severe that many victims required surgical removal of their testicles. The removal surgeries were often performed without adequate anesthesia, adding a second layer of torture to the process. Others developed radiation sickness and died within days, their bodies ravaged by the massive radiation exposure. A prisoner doctor who was forced to perform follow-up examinations on victims described men whose scrotums had swollen to the size of footballs, with skin blackened and peeling from radiation burns. The pain was so intense that some victims begged for death. Many committed suicide when they understood the permanent nature of their injuries. The doctors meticulously documented the effectiveness of their methods through forced follow-up examinations and surgical removal of reproductive organs for study. When women died, their entire reproductive systems were removed for examination. When men succumbed to radiation sickness or infection, their testicles were preserved for research. A surviving prisoner doctor who witnessed these atrocities later described the atmosphere in Block 10. The medical staff who performed these experiments maintained a clinical detachment that seemed almost more disturbing than overt sadism would have been. They discussed results during lunch breaks, compared notes on techniques, and planned refinements to their methodologies, all while ignoring the human suffering their work created. These weren't medical procedures in any recognizable sense. They were calculated mutilations performed with cold efficiency. The screams from Block 10 became so commonplace that prisoners in nearby blocks would know which experiments were being conducted based on the intensity and duration of the victims' cries. Among the most immediately lethal experiments at Auschwitz were those designed to benefit the German military, particularly the Luftwaffe, Air Force, and the Navy. With German pilots being shot down over the North Sea and sailors facing the frigid waters of the Atlantic, Nazi doctors sought to determine human tolerance to extreme cold and the best methods for reviving hypothermia victims. The practical military application gave these experiments a veneer of legitimacy that attracted funding and attention from Berlin. High-ranking military officials would sometimes visit to observe procedures and review results. Their presence reinforced the doctors' belief in the importance of their work, regardless of the human cost. Prisoners were forced into vats of ice water and kept there until they lost consciousness. The tanks were fitted with medical monitoring equipment to track the victim's vital signs during the process. Doctors would stand around the tank with stopwatches and clipboards, noting each stage of the body's response to the freezing temperatures. Some were left outdoors naked in freezing temperatures for hours. These victims were positioned in various postures to simulate downed pilots, with some allowed to wear partial flight suits, while others were left completely exposed. Their core body temperatures were continuously monitored as they froze to death. A German medical technician who later testified about these experiments described how doctors observed and recorded their suffering in clinical detail: the violent shivering, the bluing of skin, the mental confusion, and finally, the heart failure. Many victims begged for death as their extremities froze and the pain became unbearable. Some offered information, money, anything they could think of to end the torment. The doctors simply continued taking notes. The documentation from these experiments reveals the progression of symptoms in excruciating detail. Initially, victims would shiver violently as their bodies attempted to generate heat. Their skin would turn blue, starting at the extremities and gradually spreading. They would lose the ability to speak coherently as their core temperature dropped, often becoming delirious. Eventually, their heart rates would slow dramatically before cardiac arrest occurred. Attempts at rewarming used various methods: gradual warming with blankets, immersion in hot water, even forcing hypothermic prisoners into intimate situations with women conscripted from the camp. A doubly dehumanizing procedure that traumatized both parties involved. These methods were tested systematically, with groups of victims assigned to different rewarming protocols to determine which produced the highest survival rate. The female prisoners forced to participate in these rewarming experiments suffered their own form of torture. Many were sexually assaulted under the guise of medical procedure, with their bodies used as tools without regard for their dignity or consent. The psychological trauma of being forced to participate in another's torture created victims beyond those directly subjected to the cold. A significant number of these experiments were conducted under the direction of Dr. Ernst Holzlöhner and Dr. Sigmund Rascher, though the research continued at Auschwitz even after their departure. Hundreds died during these studies, and those who survived suffered permanent tissue damage from frostbite. Former assistants described victims whose fingers, toes, ears, and noses turned black and eventually fell off as tissue necrosis set in. Some survivors had to undergo amputations due to gangrene. Even those who escaped without losing limbs often suffered nerve damage that caused chronic pain for the remainder of their lives. The data from these experiments was considered so valuable to the German military that it was carefully preserved. After the war, there was significant debate among Allied medical researchers about whether this tainted data should be used to save lives in the future, a profound ethical dilemma that continues to shadow medical ethics discussions today. Auschwitz also served as a testing ground for German pharmaceutical companies eager to try new drugs without the inconvenience of safety protocols or patient consent. Companies including IG Farbin, which had built a factory next to Auschwitz to exploit prisoner labor, provided experimental compounds to camp doctors. The relationship between IG Farbin and the Auschwitz medical facility reveals the corporate complicity in these atrocities. Company executives visited the camp regularly, meeting with doctors to discuss results and provide new compounds for testing. The pharmaceutical giant benefited from a testing process unrestrained by ethical concerns or regulatory oversight. Prisoners were deliberately infected with pathogens like typhus, malaria, and tuberculosis, then treated with experimental drugs. The progression of their diseases and their responses to treatment were documented without regard for their suffering. When treatments failed, autopsies followed to examine the drug's effects on internal organs. Former assistants described how doctors would monitor these disease progressions with detached interest. They would measure fever curves, document rash patterns, and track organ failure as though observing laboratory animals rather than suffering humans. Failed treatments weren't seen as tragedies, but as necessary data points in the research process. In Block 46 of Auschwitz I, Dr. Helmuth Vetter tested new sulfonamide drugs on artificially wounded prisoners. He deliberately created infected wounds, introduced gangrene and tetanus bacteria, then attempted to treat the resulting infections. Many victims died in excruciating pain as their bodies were consumed by preventable infections. A prisoner nurse who assisted in these procedures later described Vetter's methodology. He would create identical wounds on multiple prisoners, typically deep incisions on the thigh or calf. Some wounds would be intentionally contaminated with dirt, fabric, or bacterial cultures to ensure infection. Various experimental compounds would then be applied to different groups, with untreated control subjects left to suffer the full progression of infection. The suffering these experiments caused was immense. Gangrene produces a distinctive putrid odor as tissue dies, and witnesses described the overwhelming stench that permeated Block 46. Victims would watch in horror as blackened tissue spread across their limbs, powerless to stop the advancing infection. Dr. Johann Paul Kmer, who kept a detailed diary of his time at Auschwitz, selected prisoners suffering from starvation for his studies on the effects of hunger. His particular interest was in how the liver changed as starvation progressed. He conducted liver biopsies on living subjects without proper pain relief, then sent them to the gas chambers when he had gathered his data. He would then attend their autopsies, removing organs for further study. Kmer's diary entries reveal the disturbing contrast between his mundane personal concerns and the atrocities he performed. He would describe in the same paragraph an interesting autopsy and what he had for lunch afterward. In one entry, he noted performing a live biopsy on a prisoner in the morning and attending a concert in the evening. This juxtaposition of the ordinary and the monstrous reveals how thoroughly normalized the horror had become in his mind. An entry from Kmer's diary reads with disturbing casualness about examining a living subject who showed early stages of starvation. He noted clinically that the liver no longer contained any glycogen reserves, a scientific observation that obscured the fact that he was describing a deliberately starved human being who would soon be killed to complete the examination. Former assistants described how Kmer would select his research material from among the most emaciated prisoners. He would examine them carefully, looking for specific signs of starvation that interested him before marking them for his procedures. Those selected knew their fate was sealed, but were too weak from hunger to resist. The Luftwaffe's concern about pilots surviving at high altitudes led to some of the most immediately lethal experiments. Prisoners were placed in low-pressure chambers that simulated the conditions at altitudes up to 68,000 feet. Doctors observed and documented their suffering as the lack of oxygen caused excruciating pain, seizures, and eventually death. The low-pressure chambers were essentially airtight rooms where the atmospheric pressure could be mechanically reduced to simulate high altitudes. Victims were placed inside, sometimes individually and sometimes in groups, and the air would slowly be pumped out. Medical monitoring equipment attached to the prisoners recorded their physiological responses as the oxygen thinned. Those who assisted with these experiments later described the progression of symptoms in horrifying detail. As the pressure dropped, victims would first experience rapid breathing as their bodies attempted to compensate for the thinning oxygen. This would be followed by headaches and dizziness. As the pressure continued to drop, more severe symptoms would develop: disorientation, visual disturbances, and eventually seizures. Former assistants observed that victims would clutch at their heads and faces in desperation as their eardrums burst and their lungs failed. The pain of bursting eardrums was particularly excruciating. Victims would scream and claw at their ears as internal pressure built up with nowhere to escape. Blood would often seep from their ears, nose, and eyes as capillaries ruptured under the strain. Many pleaded for relief as the pressure dropped. Some would bang on the chamber walls or windows, begging to be released. Others would curl into fetal positions, gasping for breath that wouldn't come. Some would experience violent convulsions as their brains were deprived of oxygen. Doctors calmly recorded their observations, noting the precise moment when each physiological system failed. These experiments were primarily conducted at Dachau, but similar research continued at Auschwitz under different doctors. The data was compiled and sent to aviation medicine experts in Berlin, who incorporated it into training materials for German pilots without acknowledging its horrific origins. A former recording technician later revealed that some of these experiments were filmed for educational purposes. The footage was edited to remove the victims' most desperate moments and presented as scientific documentation. These films were shown to Luftwaffe medical officers as part of their training on altitude sickness prevention. Not all the medical atrocities at Auschwitz involved physical experimentation. The camp's psychiatric unit, under the direction of Dr. Bruno Weber, conducted psychological experiments designed to study the mental breaking points of prisoners and develop more effective interrogation techniques. Weber had been a practicing psychiatrist before the war, with a legitimate research interest in human response to extreme stress. At Auschwitz, he perverted this professional knowledge to systematically break the human spirit. Studying the process with clinical detachment, prisoners were subjected to extended isolation, sleep deprivation, and various forms of psychological manipulation. Some were held in specially designed cells, where light and sound could be completely controlled. They would experience days of total darkness, followed by blinding light, or deafening noise followed by complete silence. The unpredictability of these changes was specifically designed to create disorientation and anxiety. Some were given psychoactive drugs and then interrogated for hours. Former assistants described the use of various substances that produced hallucinations, confusion, or extreme suggestibility. Victims would be questioned while under the influence, often revealing information about resistance activities or other prisoners that they would never have disclosed otherwise. The guilt of these forced betrayals created yet another layer of psychological damage. Others were subjected to simulated situations or forced to witness the distress of family members. In one particularly cruel procedure, prisoners would be told that their loved ones would be spared if they volunteered for experiments. After agreeing, they would then be forced to watch as their family members were taken away regardless of their sacrifice. These elaborate deceptions were designed to study the breaking of human bonds and the collapse of moral resistance. A prisoner who cleaned the psychiatric unit described hearing victims in isolation cells talking to themselves, arguing with hallucinations, or pleading with imaginary guards. Some would recite prayers or sing songs from their childhood, clinging to these remnants of their former lives as their minds unraveled under the pressure of the experiments. The psychological experiments left no visible scars, but destroyed victims from within. Those who survived described being systematically stripped of their identity and sense of self through calculated psychological pressures. Many committed suicide or developed severe, lifelong psychological disorders as a result. A former assistant in the psychiatric unit later testified that Weber would often predict exactly when a prisoner would break down completely, demonstrating an unsettling understanding of human psychological limits. He approached this process with the same precision other doctors applied to physical experiments, viewing the destruction of a human psyche as simply another research parameter to be documented. These psychological techniques were documented and shared with the Gestapo and SS interrogation units throughout occupied Europe, creating a legacy of torture methodology that would unfortunately influence interrogation practices in conflicts decades after the war. With German naval personnel at risk of being stranded at sea, Nazi doctors sought methods to make seawater drinkable. Rather than focusing solely on desalination technology, they conducted human experiments to determine if chemical additives could make seawater safe to drink. At Auschwitz, groups of prisoners were deprived of all food and normal water. Some received no water at all, others received unmodified seawater, and others were given seawater treated with various chemicals meant to disguise the taste or reduce its harmful effects. A medical orderly who assisted with these experiments later described how the doctors divided victims into experimental groups. Each group received different water treatments, with their intake carefully measured and documented. The subjects were kept in separate rooms to prevent them from sharing water or interfering with the results. Guards were posted to ensure no unauthorized water was consumed. The subjects, primarily Roma, gypsy prisoners, suffered extreme dehydration, hallucinations, convulsions, and madness before death. Former assistants described victims begging for water, licking condensation from walls, and eventually drinking their own urine in desperate attempts to slake their thirst. As dehydration progressed, Their tongues would swell, their lips would crack and bleed, and their skin would lose elasticity. Doctors recorded their deterioration in detail, noting how long it took various groups to die and the specific symptoms they exhibited. They were particularly interested in comparing the progression of symptoms between those drinking no water at all and those consuming seawater, attempting to determine if untreated seawater was better or worse than complete dehydration. Even children were included in these experiments. Former observers described children crying desperately for water as they were denied relief. Some would become so desperate they would drink the seawater despite its revolting taste, only to suffer worse as the salt content further dehydrated their bodies. Many died within days, their small bodies unable to withstand the extreme fluid loss. The doctors conducting these experiments maintained detailed records of urine output, blood chemistry, and tissue changes as dehydration progressed. Victims were weighed daily to track water loss. When they died, autopsies were performed immediately to examine the effects of extreme dehydration on internal organs. A nurse who was forced to assist with these experiments later revealed how the doctors would sometimes place containers of fresh water within view, but out of reach of the test subjects. They would observe and document how this psychological torture affected the progression of symptoms, noting that subjects who could see but not access water often deteriorated more rapidly than those who had no water in view. These experiments continued until it became clear that no chemical additive could make seawater safe to drink. The research was abandoned, but not before dozens of victims had died in agony from dehydration, their bodies exploited to answer a question that could have been determined through less lethal means. The scope of medical atrocities at Auschwitz extended beyond the specific experimental programs. The entire camp operated as a massive laboratory where the boundaries between research, murder, and industrial processing of human beings blurred into a system unlike anything seen before in human history. Medical personnel were integrated into every aspect of the camp's operation. They supervised the gas chambers, declaring victims dead before bodies were processed. They developed more efficient methods for disposing of corpses. They determined work capacities for slave laborers, calculating precisely how long a starving human could be worked before death. This medicalization of mass murder was perhaps the most profound perversion of medical ethics. By applying medical terminology and procedures to killing, the Nazi doctors created a system where genocide could be perceived as a public health measure rather than a crime. Deaths were recorded in medical logs, with causes falsified to mask the reality of systematic murder. A former administrative clerk described how doctors would routinely list causes of death like heart failure or pneumonia for prisoners who had been worked to death, beaten, or simply selected for killing because they were no longer useful. This medical documentation created a veneer of legitimacy that obscured the reality of murder. Beyond the experimental blocks, regular camp hospitals functioned as holding areas for prisoners too weak to work, but not yet selected for immediate killing. Medical care was minimal to non-existent. A former prisoner nurse described how they would sometimes have nothing but aspirin to treat serious illnesses, and even that was in short supply. These hospital blocks became places of nightmarish conditions. Without proper supplies, sanitation, or medicine, infections spread rapidly. Wounds festered, diseases ran rampant, and patients lay on bare bunks, often several to a space designed for one. The smell of gangrene, excrement, and unwashed bodies created an overwhelming stench that permeated the buildings. Yet even in these hellish conditions, some prisoner doctors and nurses attempted to provide real care. At great personal risk, they would sometimes smuggle medications from the SS pharmacy or create improvised treatments from available materials. These small acts of medical integrity stood in stark contrast to the corruption of their SS overseers. As Allied forces approached in January 1945, the Nazi doctors at Auschwitz hastily destroyed records and evacuated with valuable specimens. Mangallay escaped with his research notes and twin blood samples, eventually fleeing to South America, where he evaded capture until his death in 1979. The retreating SS attempted to conceal evidence of their crimes, burning buildings and records. But the scale of the medical atrocities was too vast to hide completely. Allied medical officers who entered the camps were horrified to discover experimental equipment, surgical theaters, and preserved specimens that testified to the scope of the horror. The The liberation of Auschwitz revealed medical facilities perverted beyond recognition. Examination rooms still contained instruments of torture. Laboratory refrigerators held preserved organs and tissue samples. Filing cabinets contained partial records of experiments that had claimed countless lives. Other doctors were captured. At the subsequent Nuremberg doctors' trial of 1946 to 1947, 23 physicians and administrators stood trial for their crimes. The trial transcripts reveal how these educated professionals attempted to justify their actions. Some claimed they were following orders. Others insisted their work had legitimate scientific value. A few expressed remorse, but many remained convinced they had done nothing wrong. 7 were sentenced to death and executed, while others received prison terms of varying lengths. Many more escaped justice entirely, returning to medical practice under assumed names or in countries sympathetic to former Nazis. The Allied medical officers who processed the evidence were profoundly affected by what they discovered. Many would later report nightmares and psychological distress from what they had witnessed. The revelations challenged their fundamental understanding of their own profession, forcing them to confront how medicine could be corrupted when divorced from ethical constraints. The revelations of these medical atrocities led directly to the creation of the Nuremberg Code, the first international document to set ethical standards for human experimentation. Its first principle states unequivocally that the voluntary consent of the human subject is absolutely essential, a direct response to the forced experimentation at Auschwitz and other camps. The code wasn't just a reaction to Nazi crimes, it was an attempt to create safeguards that would prevent such abuses from happening again. Its 10 points established principles that would later be incorporated into medical ethics codes worldwide, forming the foundation of modern research ethics. Today, every medical research protocol, every pharmaceutical trial, and every experimental treatment must follow ethical guidelines that were written specifically to prevent the recurrence of what happened at Auschwitz. Medical ethics courses worldwide teach the Nazi doctor experiments as the ultimate boundary that must never again be crossed. Modern bioethicists emphasize that the shadow of Auschwitz looms over contemporary medicine. Every ethical guideline in existence today was born from looking back at what those doctors did and saying, never again. Perhaps the most important lesson isn't just that these acts were horrible, it's that they were committed by highly educated professionals who convinced themselves they were doing something necessary and important. For survivors of these experiments, the end of the war brought freedom, but not healing. Many suffered lifelong physical and psychological consequences that continued decades after liberation, creating a legacy of pain that extended far beyond the camp fences. Women affected by Clawberg's sterilization experiments could never have children, a loss that continued to cause grief throughout their lives. Many experienced chronic pain, recurring infections, and other gynecological issues that required ongoing medical care. Yet many survivors reported being too traumatized to seek proper treatment, their fear of medical professionals so profound that they endured suffering rather than submit to examination. Mangallay's twins experienced recurring health problems that puzzled doctors, unfamiliar with what had been done to them. Without access to records of the experiments, physicians treating survivors often couldn't understand the cause of their unusual symptoms. One twin survivor described living with mysterious illnesses for decades, only discovering their probable cause when meeting other survivors who shared identical symptoms. The physical scars were visible, the tattooed numbers that never faded, the surgical scars from procedures performed without proper care, the missing organs and limbs. But the psychological wounds ran deeper. Survivors described flashbacks triggered by the most mundane medical experiences. A simple blood test could cause panic attacks. The sight of someone in a white coat could trigger intense anxiety. Even the antiseptic smell of hospitals could provoke powerful traumatic memories. Former assistant camp doctors who had been prisoners themselves struggled with their own form of trauma. Forced to participate in atrocities to survive, many lived with crushing guilt despite having had no real choice. One former prisoner doctor described how he contemplated suicide for years after liberation, haunted by the memory of procedures he had been compelled to perform and lives he could not save. Victims of cold experiments suffered chronic discomfort from nerve damage that never healed. Many described a perpetual chill they couldn't shake, even in warm environments. Their extremities would turn blue in mildly cool temperatures. The damaged circulation, a permanent reminder of what they had endured. Some experienced phantom pain in fingers and toes that had been amputated due to frostbite, their nervous systems still registering agony from limbs long gone. The psychological impact was often even more devastating. Many survivors reported lifelong nightmares, anxiety disorders, and profound difficulty trusting medical professionals. Even routine medical procedures could trigger overwhelming overwhelming panic. Survivors described breaking into cold sweats at dentist appointments or fleeing doctors' offices when asked to undress for examinations. Some avoided necessary medical care throughout their lives because the sight of doctors in white coats triggered unbearable flashbacks. This medical trauma created secondary health problems as survivors aged. Treatable conditions went undiagnosed because survivors could not bear medical examinations. Preventable complications developed because necessary medications weren't taken. The torture they had endured during the war continued to damage their health decades later, creating a ripple effect of suffering that extended far beyond the camp's liberation. Survivor testimony reveals how the experiments destroyed their sense of bodily autonomy and personal dignity. One woman who had been subjected to Clawberg's sterilization procedures described feeling forever violated in the most intimate way possible. Others spoke of feeling like their bodies had become foreign territory, no longer fully their own. This disconnection from self represents a profound psychological wound that many carried throughout their lives.